An AI model can be incredibly accurate, but it can still be the wrong model for your patient. Today we dive into bias and what questions you should be asking yourself anytime you use AI in healthcare. Here's the trap. Most AI tools get reported as one single headline number, accuracy, AUC, sensitivity, but patients don't really come as averages. Bias is when a model's errors are not evenly distributed. It works great for one group of patients, but fails for another group of patients. A good way to think about this medically is calibration. Imagine you have an art line. If the art line is dampened, you don't get random errors. That's a systematic error, and all your blood pressure is going to be consistently low. Bias in the AI is the same kind of systemic miscalibration, except it's often tied to who the patient is, where they're treated, and how that data was collected. With the art line, we have ways to determine when it's dampened and fix it, but we do not yet have the tools to determine systematic errors occurring with AI in healthcare. So let me give you two real-world examples to showcase how bias could show up. A widely used population health algorithm was designed to identify patients who needed extra medical care and outreach. Sounds great, right? But the model used healthcare cost as a proxy for how sick someone was. And because Black patients often have lower healthcare spending due to unequal access and structural barriers, the model systematically underestimated their need for medical care, even though they were equally sick as a Caucasian patient. Now, the model wasn't trying to be racist, it was just trained on biased data. And that's the core lesson here, that bias often enters through the target that you choose. If you train on cost, you're learning the healthcare system. If you train on diagnostic codes, you're learning documentation behavior. And if you train on who got this ICU bed, you're learning resource allocation, not pure physiology. Something similar happened with the dermatology AI model. A group created the diverse dermatology images dataset because many of the dermatology AI models were trained on mostly Caucasian skin tones. When the state-of-the-art dermatology models were tested on these diverse skin tones and less common diseases, the performance and accuracy dropped by almost 30 to 40%. That's what bias looks like in practice. The model seems amazing until the patient doesn't look like the training data. So the bias isn't just one single variable, it's a pipeline problem. What data gets captured, who shows up in the data set, how labels were created, what the model is optimizing for, and whether anyone ever checked subgroup performance. And clinically, the question I want you to be asking yourself is not whether the AI model is accurate, but ask, is it accurate for who and under what exact conditions?